Thank you very much. So yes, Mike, I'm the CEO of a company called CUPRIS. And I'd like to talk to you about our smartphone connected medical devices. There's our Twitter handle, so do engage with us if you're into that sort of thing, photos, engage with what we're doing. But firstly, before I start, do we have any medical doctors in the room? Hands up. Fantastic. I'm going to pick on you. I don't know what your specialty is, but can you tell me what this image is up here? Any takers from the doctors in the room? Oh, I've got someone gesturing. Yes, it's a tympanic membrane or an eardrum to us non-doctors in the room. But this isn't any old eardrum. This is a very special eardrum. This eardrum is actually my eardrum. And I took this image myself with my smartphone with this little device that we've developed clipped onto the back of it. So I'm going to attempt to do a live demo of the product a little later on. It's guaranteed to be a disaster, so I'll push it to the end of the presentation. But before that, I'd like to talk about why on earth we'd want to do this. So this is my business partner, Jules. Jules is a consultant or a senior ear, nose and throat surgeon in the UK National Health Service, the NHS. And CUPRIS was founded because Jules feels that communication in healthcare is broken, and that this breakdown in communication leads to a large proportion of the patients that Jules sees on a daily basis being unnecessary. We believe that these patients could be much better cared for closer to home using smartphone technology. This problem isn't restricted to ear, nose and throat. It's not restricted to Jules's experience. It's actually estimated that in the NHS, 50% of all outpatient hospital consultations could be avoided through remote examination. This is a multi-billion-pound problem for the NHS. But this problem isn't even restricted to the NHS. This is a global problem felt throughout the developed world. There's also a huge problem in developing countries, and with hearing loss in particular. 1 in 20 people around the world suffer from some form of disabling hearing loss. That's 360 million people. This problem can lead to social isolation, delays in learning and development, and can affect the economy of a country. The good news is that 60% of these cases are avoidable with early intervention and detection. The bad news in lower middle income countries is that they simply don't have the infrastructure and the resources to provide the care, the basic primary care needed to detect these basic ear conditions early enough to prevent them turning into hearing loss. For example, in India, 70% of the population live in rural areas, where just 25% of all healthcare resources are located. And in Malawi in Africa, it's a country of 17 million people, and they have just 2 ear, nose and throat doctors. So there's a clear difference between the supply and the demand there. So how do we solve that problem? Well, with our product, anyone with extremely limited training can capture a clinical examination of a patient's ear. They don't have to be a doctor. It could be anyone with a very small amount of training. They can then use our software platform to capture the patient's history. You can perform a hearing screening test with the app. And to be clear, this software isn't restricted to ear, nose, and throat. The software can be used across multiple different specialties and health conditions. So once you've captured that examination, you can send that examination to our secure cloud platform, and from there be passed on to healthcare professionals who can provide a diagnosis or give advice without having to see that patient in person. This saves time for the patient, this saves time for the doctor, it saves money for stretched healthcare providers like the NHS in the UK, and it extends care to individuals living in remote locations who otherwise would simply have no access to care. So imagine a number of you recognize the device on the left. It's called an otoscope. I'm sure all of you have had a doctor stick one of those in your ear at some point in your life. Our device completely changes the value proposition. You can see a much larger image of the condition, and you can capture images and videos of that condition. You simply can't do that with the basic otoscopes used by the majority of doctors. And in the testing that we've done so far, patients absolutely love being able to see their conditions, and they can understand what's going on a lot better, and doctors really like using it to improve the relationships they have with their patients. But the key game changer for us is the remote connectivity. Once again, providing that remote advice without having to see the patient in person. So I'd like to share a brief case study with you of some trials that we've done in Nepal, in a remote community in Nepal. I was really hoping that we would have published the results by now. Unfortunately, they're not published, so I can't tell you too many details. But with the study, some doctors went out to a remote village in Nepal and carried out a health clinic. A patient would be seen by a senior ear, nose and throat surgeon, record the diagnosis. They'd then go on and see someone using our platform to record the examination. And then that consultation was sent remotely to a surgeon in the UK who would also record their diagnosis. So once again, I can't provide the statistics, but I'm allowed to say that it's very promising, and it's demonstrated that we do have a very effective tool for providing the remote diagnosis of these conditions. And it's incredibly exciting for us because with this platform, once again, you can have these individuals with very limited training going out into the communities, carrying out clinics in the community, and really stopping these conditions that lead to hearing loss in their tracks. This is something that is not happening on a wide scale at the moment in these countries. So a few milestones from a company. So we've received a number of awards for our innovation. We've been featured quite widely in the press, in the BBC, in the national press in the UK, Wired magazine, to name a few. And we've been heavily supported by the NHS in the UK. We've been supported by an organisation within the NHS called the SBRI. They provided the vast majority of our funding to date. It's paid for the completion of our product. It's paid for further clinical trials which are going on in the NHS at this moment. So far, the results are looking fantastic. We've got another couple of months to run. We've seen about 200 patients so far. And we've also been supported by an organisation called Digital Health.London. It's an accelerator programme based in London that's supported by all of the major NHS organisations in London. It's only just started, but so far it's been a fantastic help. The product is CE marked, so it's approved for sale anywhere in Europe. And the development of our product is complete. We're just going through the final stages of development with our manufacturers, and we're going to be ready for sale in the next couple of months. So we're going to be launching across Europe at that point. But finally, before the demo, I thought I'd give you a bit of an overview of the team. So I've mentioned Jules, who's a consultant ear, nose and throat surgeon in the NHS. Paul is an award-winning designer and entrepreneur. He's got 2 successful startups under his belt. He also spent 7 years at Nokia before the iPhone came along, and co-developed the world's largest ever selling electronic device, the Nokia 1100. We've got a fantastic team covering engineering, software development, and business development. So now, here's where it all goes wrong. I'm going to attempt to give you a bit of a live demo. So I hope you guys aren't too squeamish, and I apologise in advance if you happen to see some of my earwax. I think it takes a little while to switch over.
I think you should ask for a volunteer for this.
Well, I'm not sure my insurance covers me, my holiday insurance. But yeah, so here's my brief health record. We've designed it to look very much like your WhatsApps, your Facebook messages, etc. So it's immediately familiar to the healthcare professional and the patient using it. This is something that's generally neglected in healthcare at the moment. You have these really ugly systems which aren't user-friendly. So that's something we focused on a lot. So yeah, you can then look to add a clinical image. So here we go. And there we are. There's my lovely, there's a bit of earwax on the side. And so you can capture an image there. And once you've captured that image, you can then send that to your record. You can also record audio notes. You can fill out a skip logic questionnaire. This is what we use to replicate the sort of questions a doctor would ask a patient in person. And so once you've compiled all of that information, you can then share that with a healthcare professional, once again, much like WhatsApp, and have a very open discussion about what's going on. So yeah, this is what we do, and thank you very much for your time, and I'll be happy to answer any questions that you have.
Interesting. So may I ask, the cost for the device, if you compare it, is it cheaper or more expensive if you have the phone?
Yes, it's significantly cheaper. So a standard otoscope costs anywhere between 150 and 250 pounds. We're looking to, and that doesn't capture the images, it doesn't allow you to share the information, whereas our device, we're selling it for under 100 pounds. We're starting at 99 pounds. But we do have the capacity to sell it a lot cheaper for developing markets, depending on the model.
Another question I had, I mean, for the developing world, I mean, if you do the diagnosis, but you still have the problem with the subsequent care, so are you engaging in that step as well? Yeah, so it's a kind of multi-stage process. So initially we're engaging with charities and NGOs. They're the guys that have the links in these markets to really provide the subsequent care. A lot of the things, I mean, often it's things like blockages in the ear. Left over time can result in hearing loss, and those conditions can be resolved in the community. But yes, if there is a serious condition, they can then be referred onto the hospital. At the moment, they have to go to the hospital, whatever, and often that's a wasted trip. So they know if they're going to the hospital, they really need to make that effort. And I guess the software is the key thing here, or is it the actual device? Yeah, the software really is the key. So I guess it's similar to what Keith was saying before, that yes, we've got some cool devices. So this is our first device, the otoscope. We're also developing an ophthalmoscope for retinal imaging and a number of other devices as well. Yes, they're smart bits of kit which really do add value for the patients and for the doctors. But where we see the real long-term value that we're adding, it's through the software platforms, opening up the remote communication of patient conditions and saving these wasted trips and making the whole system much more efficient. I mean, the retina type, then you can start diagnose diabetes early on. And I mean, it's diabetes really is a big one. Yeah, it's a real big one. Check that. Any questions from the audience, please? Loads of questions. We have one in the middle where the camera is.
Hello. I was wondering about the pictures. Do you store them in some way?
Yes. So they're both stored on your phone, but separate to your personal photographs. They're stored separately, encrypted on your phone. I mean, I've heard so many cases of doctors who use their own phone to capture images of patients, and then it pops up on their screensaver at home, and it's stored completely separately. It's encrypted on the phone, and in addition, it's stored on our secure cloud service, so it's all backed up, fully encrypted, ready to be shared and distributed.
Okay, thanks.
There's one more question down here.
Hello, my name is Daniel. What about the revenue models? Have you started thinking about those? Because it sounds like you are going a little bit global between countries and so on, or is it very regional or local? Yeah, so I guess there's two sides of it. One is the straight hardware sales. Just selling for a margin of the devices. But that's not really our long-term scalable revenue strategy. On the software side, we're looking at two different options, and it really varies case by case. One is a subscription model, where if healthcare professionals are using it in their practices in the developed world, they'll pay a monthly subscription fee. It's the standard way that they're used to paying with that sort of model for their software services. Another model is a per transaction, so per remote consultation fee. So in developing countries, there's already a lot of examples of micro-entrepreneurs working in the community in these remote locations and providing the services in these communities and charging $1 per transaction, and we'll take a small fee from that
to enable that remote diagnosis to take place. So that's the real, the two main areas.
Well, Daniel took my last question, so if there is no more, I think we should move on. Any further questions? Yeah, there's one more.
You said you were collaborating with NHS,
Yes.
in a way. So how about when they receive the pictures, how about their viewing of your storing it, the pictures, and connected with their responsibility to act?
So are you asking about whether they can access the historical data for previous conditions?
Or if they can keep the pictures?
Yes, the hospital can keep the pictures. So we're actually working with a number of the major patient management systems in the UK. So one's a company called EMIS. They have a 55% market share with GPs in the UK. So we're looking to integrate our platform with theirs, so they can capture the images using our device and our platform, and then they can upload them to their patient management systems. We've got our own API, which enables us to easily engage with various different systems. I say easily. In the NHS, we've got a vast array. In the primary care, it's easier. There's 3 main platform providers that we're looking to integrate. In secondary care and hospitals, there's a vast array of different software platforms. But yes, that's definitely our goal.
Okie doke. I think we should give Mike a warm applause. Thank you. Very interesting.